Morriston Hospital in Swansea covers a large demographic area, serving a population of just over 1 million people. Patients come to Morriston Cardiac Centre from all over South West and Mid Wales. The catchment area covers all the way from Aberystwyth down to Pembrokeshire, across the Bridgend and up to the Brecon Beacons. Patients who have a heart attack need to come directly to a centre providing primary percutaneous coronary intervention, or PCI for short. This is a procedure that takes place under local anaesthetic, where a catheter is passed from the arm or the leg to unblock the coronary artery causing the heart attack. Prior, during or after the heart attack, patients can experience dangerous heart rhythms that can lead to a cardiac arrest. In these situations, prompt medical treatment is essential to maintain life. Patients come to Morriston either from one of the outlying hospitals or directly from an ambulance. A 999 call for a patient with chest pain is a top priority. All patients who are having a heart attack go straight to the cardiac catheter lab via a blue light ambulance. The STEMI call is put out for all members of the heart attack team and the anaesthetic team if needed to prepare for the patient's arrival. A STEMI is an acronym for a heart attack that requires urgent treatment.
STEMI call for coronary care unit, ETA 30 minutes. STEMI call for coronary care unit, ETA 30 minutes.
David was admitted directly to the cardiac catheter lab after suffering a large heart attack and a cardiac arrest at home. We had a call to say that a patient with an inferior posterior STEMI was en route. He was a 45-year-old man who had collapsed at home following severe chest pains. He had no previous cardiac history, no known cardiac risk factors other than a positive family history. His fiancée had given CPR up until the paramedics arrived. When he arrived in hospital, he was in cardiogenic shock. The ECG showed a large heart attack.
Hi, my name is David Lloyd. 2 years ago, I had a heart attack on the 7th of February. This is my story. It was 3:30 in the afternoon. We'd just been out shopping in the morning and just had a cup of tea, and suddenly I started feeling pins and needles in my arm. Stood up, sort of moved around. I said to Anita, my wife, I've got these pins and needles in my arm, I don't feel right. And
there for about half an hour, I think.
It sort of left for a bit, and then I've got it again. I've got to sit down. This is in the kitchen now. I was making my way to the front room, and I collapsed before I got to the settee, and then it all happened then, really.
So he collapsed, and he was clutching his chest and just sort of
gasping. Right?
Well, no, he was in pain and clutching his chest and going, but worse. And then you could just see the colour drain out of his face. He went from pink to grey to dark, and he did stop breathing. And then I think I had a go at CPR from what I remember from first aid training, but I also had my phone in my back pocket. And before the heart attack had even finished, I managed to call the ambulance. So I had the phone and I was CPRing at the same time.
I remember coming round, he was on the phone.
I did swear, and I did punch him for the last time in his chest, like that, saying, come on! And then he came back then, and he just sort of, the colour came back slowly, and he sort of said, I'm okay now, which he wasn't, but I managed to sit him up, and then the ambulance was talking through it then of what to do.
STEMI call for coronary care unit, ETA 30 minutes. STEMI call for coronary care unit, ETA 30 minutes.
David was admitted for a primary PCI. The coronary arteries are accessed via the right radial artery in the arm. It's a minimally invasive procedure. The first picture shows an occluded circumflex artery with some disease in the left main stem. The decision was made to unblock the circumflex artery, but the second picture tells another story, and at this point David became very unwell.
this is a hugely time-critical treatment. We don't have minutes to spare, we have seconds to spare. Failure to get the blood vessel open in a matter of seconds can result in the heart stopping again, which ends up in a vicious spiral downhill, and we don't rescue things. So having things available within seconds, getting blood flow back within seconds, was crucial to the success of this case.
Flow down the left coronary artery had disappeared. David went into cardiac arrest. CPR was started and the anaesthetic team intubated him. An intra-aortic balloon pump was inserted to support the heart as the team attempted to fix the left coronary artery. David arrested again, and an automated CPR device was used to allow good cardiac perfusion to maintain blood pressure, all whilst the artery was being stented. David was transferred to the intensive care unit following the procedure. He was ventilated for 9 days and has no memory from the time that the ambulance was called.
I remember waking up, you telling me you'd been in a coma for 9 days, and I was completely shocked. Couldn't believe it. I thought you were joking to begin with.
I know.
Yeah, and
First thing I told you was you'd missed Valentine's Day. No, actually, first thing I told you was that I loved you, and the second thing was I told you I'd missed Valentine's Day.
yeah. So
So what do you remember when you woke up after the 9 days? Your experience of being in hospital?
I remember having something down my throat, and that was really uncomfortable and really stressful. That was having the stuff down my throat.
You remember?
Yeah, that was terrifying.
You remember hallucinations?
Yeah, from the-
terrible hallucinations, didn't you?
From being under, yeah.
First 24 hours on the general intensive care unit were very, very difficult. He was on maximum support to keep the circulation going. And we had to be very guarded as to whether he would survive this, and probably just as importantly, how much injury there might be to the brain due to the lack of blood supply during resuscitation. Whilst the resuscitation had been prompt, he'd had a low blood pressure for quite some time. We became more optimistic after about 1 day, 2 days, because the original ultrasound scan that was done on the intensive care unit in the first few hours after the angioplasty showed that the heart muscle was struggling very badly. But within 24, 48 hours, we could see quite marked improvement in the function of the heart on the echocardiogram. And indeed, all the other markers that we look for an improvement in output and performance of the heart were looking up as well. And I think my conclusion would be that the heart had been what we call stunned in quite a major way during this particular insult, but had managed to recover reasonably well within 2 or 3 days. And his progress after that was really very encouraging indeed. Once things started to pick up, once the output from the heart improved, he just continued to get better and better and better.
So after all the event, you came back downstairs to coronary care.
Yeah.
And do you remember anything about being down there?
I started coming back to myself then, really. Yeah, I started feeling a bit more human again. I remember being very weak. I couldn't look after myself, couldn't do normal things. I remember once trying to go to stand up and nearly clapped my legs because I've been in bed for 9 days. My muscles are gone. You sort of notice the level of care changes from each ward.
Yeah.
It was really intensive care. Coronary was really good, and then it just sort of
Standing in the
became a normal ward. It sort of,
treat you more normal then, yeah.
So I was very keen to go then, wasn't I?
You were, yeah. Very keen to come home.
When I got home, I suddenly realised, I'm on my own now. All the security, the hospital was gone, and the first night at home was terrifying, wasn't it? We didn't sleep.
No, you thought you had
every
chest
little
pains.
twinge, every little thing. What's happening now? Things you ignore normally suddenly are blown out of proportion.
Very anxious, weren't you?
Yeah, very anxious.
Yeah.
As the weeks went on, it slowly got better. I don't feel I'm the same person as before, and I think
We don't take things for granted.
yeah, it was something that was completely out of the blue for me. Even though I was aware of my dad having a heart attack, it's something I'd never prepared for, or thought about, or would happen. Certainly not in my 40s. I suppose I'm philosophically asking you sort of why. There's family history and all this sort of thing, but trying to understand why something like that happened at 45. I'm still trying to work out. Yeah.
Dave was on full dialysis as well, and I think that was stopped within something like 48 hours. So the fact that the body was starting to function again was good. And every day we took pleasure in the small steps. Slowly you could see recovery, and then after the third day, Dr. Ramsey said once the heart, after 72 hours, it starts repairing itself. And I think you had an echocardiograph then, and things were looking good. It was every day we looked positive, and every day we looked forward. I never ever said if, I just said when. So I think being a relative, you need to be informed constantly of what's happening. And I was. I did ask an awful lot of questions. We like to know what's happening, why certain drips were put in, why certain procedures were being done. The fact that if you're in the knowledge, then you can understand it more. If you're not told anything, then you can't understand it and cope with it very well.
Even though all this great care is going on, this fantastic medical innovations are taking place all the time, there is a little core part inside of you you've got to draw on somehow, just to get you through, I think.
I've had a chance to review the X-ray pictures again, and the pictures for a cardiologist paint 1,000 words, in that when you see them another time around in the cold light of day, they're unpleasant second time around. They're unpleasant at the time that you're treating it, but the pictures themselves say we've got a big problem here, and particularly when the left main stem is involved in someone with a circulation to the heart that's fed almost exclusively through it. And it's just seeing how one blood vessel opens, the other one closes, the other one opens, the other one closes, and just seem to toing and froing between the two blood vessels, but never get into a position where you can get stability and everything open. And clearly the case was very, very difficult, even looking back in hindsight.
If it had happened when I wasn't there, if I hadn't have done CPR, Dave may not have survived, or he may have survived, we'll never know. Then would he have just sat up and thought, oh, that was strange, and not called an ambulance?
It would only have circumstances only need to be a little bit different.
Yeah.
Everything, the whole scenario would have been.
Yeah, and I often think that day Dave could have died.
He didn't.
No, he didn't, thanks to cardiology. So 3 things I said to Dave when he woke up, didn't I? Can you hear me? And you shut your eyes to say yes.
Oh, yeah. I was speaking yes or no for my eyes.
Yeah. And I said, do you love me? And he said yes. And I said, shall we get married? And he said yes. So we did. We got married 6 months later.
Yeah.
And you got stronger every day because he had purpose.
Yeah.
So.
Following on from his heart attack, David has helped us raise awareness and funds for a new automated CPR device in Morriston Cardiac Centre.